I'd now like to introduce Dr. Willie Parker, the Medical Director for Planned Parenthood of Metro Washington.
Good afternoon. I'm delighted to be here with you. As Cecile said, I'm Willie Parker, Medical Director of Planned Parenthood, Metro Washington, and I'm also a board member for Physicians for Reproductive Choice and Health. It's a doctor-led advocacy organization. Now, Congress is about to vote on two very important issues that are very essentially important to our country. That is, health care for millions of people who don't have access to it, and the unrestricted access to confidential abortion services for women. I, like you, care about that, and I want to make sure that they get that issue right. So that's why I'm here. As an obstetrician gynecologist who did not always provide abortions, I am clear that when I see patients that have issues with their health and they can't access services, and I include in that abortion care, I understand what's at stake for women if we don't enact health care reform. There are women who don't get access to basic screening services to prevent cancer. There are women who can't access services to manage their medical problems, and all of these affect the family members that they are responsible for. Why don't you let me make this real for you by telling you about a patient that I recently cared for. Janice is a 31-year-old woman, 2 kids, who had recently lost her job and therefore her health care coverage, and she found herself, as a single mother of 2 kids, pregnant. She decided that she was already struggling and that she just could not provide care for another child. So she came to me seeking abortion services. When we examined Janice so that we could figure out what would be the best way to care for her, we figured out that she had a very serious problem. She had an abnormal placenta that potentially would cause a life-threatening hemorrhage, and in a case of emergency, maybe a hysterectomy, losing her future childbearing ability. So the best thing to do for Janice was to take her to the hospital for an abortion. But unfortunately, the cost of abortion in a hospital was prohibitive for her. So the best thing and the only thing that I could do for her was to refer her to a county prenatal clinic with the hopes that someone could manage her high-risk pregnancy for this pregnancy that she did not want to continue, that potentially could cost her her life or her future childbearing That shouldn't be. As I close, let me tell you what is the bottom line. My colleagues and I have too many patients like Janice, people who, or women in particular, who can't do what's best for them and their families, and because simply they can't afford it. So I want you to know, as it's been stated, that the Supak Amendment, if it's a part of healthcare reform, will visit this reality that Janice faces on millions of women unnecessarily. We cannot and we will not let that happen. Thank you.